most famous physical therapist on the internet.
Hi, folks. I'm Bob Shump, physical therapist.
I'm Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
And
Bob.
Brad has a story for us today.
Bob, like I was just going to get into, this is about 10 years ago. My wife and I were out riding our road bikes, and we were drafting. So she was right behind me,
Gotcha.
using my draft to keep up to me. I mean,
Not difficult.
yeah.
to do.
Anyways, so I'm riding along, and we're doing about 20 miles an hour, just a little over 20. And all of a sudden, I hear this sound of like flesh hitting the pavement and
Oh,
a
gosh.
bicycle. And I look behind me, and sure enough, there was my wife laying on the road, all twisted up. The bike was,
Is this
twisted.
the time she dented her helmet?
She broke her helmet.
Oh, my gosh.
The helmet, and that's what's supposed to happen. The helmet breaks so your head doesn't. And she's lying there on the road. It's a county road. Traffic could be coming anytime because it was in the morning before work. And it's like, oh my goodness. And I go back there, and she's moving and she's talking, but she's not doing very well. Anyways, we ended up, someone came along and helped us out and called 911, and we got her the ambulance there, and she ended up being okay. No concussion, nothing serious, but she did not only that protected her head, but her shoulder came down on the pavement
Good.
and dislocated her
Problem.
AC joint and the GH joint, the humeral head. And since then, again, about 10 years ago, she's had chronic shoulder pain, kind of on and off, functioning fairly well. But what would happen if she would reach over like this, and this is a test for the AC joint. We're going to get into this. So we do have in the title have relating this to AC, the acromioclavicular joint, which is a common joint that gets injured on shoulders.
So you see kind of this S-shaped bone.
Let's see.
That's the acromion. I mean, that's the clavicle.
Clavicle, yeah.
Yes.
This is the acromion. We're getting backwards. And this tissue here is the ligaments that connect the two.
Right.
Well, this is either this
You
bone.
can actually see it over here, Brad.
Yeah, there you go. Either this bone fractures, which is very common, the clavicle
It happened
fracture.
to my son.
Sure,
He landed on his shoulder and it broke.
it broke.
It splintered.
Yep. If that doesn't happen, sometimes in her case,
It gives way.
it gives away and you get a separation from the clavicle to here. And there's a couple tests. So if you have shoulder pain from a fall, you may want to do this, or if it's even chronic, 10 years later, and this test is still positive with my wife, Julie. So,
Well, let's show the test, Brad.
all right, crossover. If this was the shoulder, you
Very
go
simple.
over like this, grab the elbow and pull. And if it's painful, you may have a problem now. And do it, Bob. Let's pull this up. We have some tape on here we'll talk about. But you can, like with my wife's, you can see the clavicle actually dislocate
up.
and pop up about a ½ inch. And it's a little painful, but not too bad. Her body's adapted to it, and then come back. Okay, then the other test is, you can't do this to yourself. Someone else has to. Here's the clavicle. You put your palm right on the clavicle.
Right on the bone.
And then on the back, your other palm goes here, and then you squeeze in and see if it implicates pain, or you can feel movement, or both.
That's also called the collarbone.
Yeah,
I mean,
right.
you
I
know-
think it's the most commonly broken bone in the body,
I wouldn't be
statistically
surprised.
speaking. So I would go like this to Bob, and I can easily feel the collarbone
Right.
back here, and I squeeze.
And the shoulder blade he's pushing on.
Yep.
But you could do this, have someone just do this to you, even if you have shoulder pain and don't know what causes it.
Right. Yeah.
Because a lot of weightlifters get this.
Oh, really?
Yes, they do.
There's a lot of stress on their particular.
stress, especially binging.
Yeah, that's what I was thinking. So, this is one of those injuries where typically time is going to heal it, but you have to
Right.
treat it properly. Don't irritate it. Okay. So this happened to my daughter too, actually playing basketball. That was about 15 years ago.
It is a common injury, isn't it?
So what did I do? I went to the kinesio tape, to save, did this to my daughter as well as with my wife. And we went to, what's his name?
John Gibbons.
John Gibbons. Get John Gibbons' book, or you can just
He's on YouTube.
Yep, he's on YouTube. He's got some excellent videos. He's
a nice
very
job.
knowledgeable on this.
Yes.
So here's the AC joint. He's taking three, and you don't have to use different colors. I just did so you can clearly see it. You go over the AC joint. I already put two on, crisscross there, make an X, and we're going to one more, pull that off.
So basically, you're trying to hold the bone down in place somewhat.
Yep. And you give it stretch. You can go stretch all the way and then back off 50 to 75%. And again, on the last half inch of the tape, no stretch at all. Put it down and then, oops, you should take this and you rub it for 30 seconds. I'm not going to take the time to do it, but do that so that it thermal
Do you
sets.
mind going over that again, Brad? So you pull the tape
Yep.
all the way,
Yep.
100%,
Yep.
and then you back off
50%,
50%.
50 to 75%. There's no exact.
So there's not that much stretch on there.
But there is stretch.
Okay.
Yeah, you definitely want to have stretch on it, and you do
Right.
that 3 times in the crisscross
And then
pattern.
there's no stretch on the ends.
Yes, you do not stretch it there, and that anchors it, sticks better
Sure.
there, and you know
They'll
that's
stay stuck.
yeah. And you rub it over. You'll
Heat it up a little bit.
yeah. You use the right side of this, and you'll feel it's very slippery. The other
And,
side,
How long can you keep the tape on?
as long as it stays on.
Sure.
Usually, you get about 1 to 2 days.
And you can shower with it on.
Yep. If you put shower with it and use soap and water, it won't stay as long.
Right.
So you just keep away from
Just
it in the
stink.
shower. Yeah. No, you just work around it.
Sure.
And then you just replace it. You know,
Yep.
when it comes off, put it on again.
And kineso tape, it seems like it's fairly, it's not harsh on the skin.
Right,
It may bother you after a while. If it does, you stop using it.
right. I've never had anybody have skin problems from kinesio tape. I have from Meccano
I
tape.
had to. I had to.
That's another story,
Yeah.
though. So, anyways, and you treat this. Now, I got to be honest with you. I've had success with this with both my wife and my daughter, but it wasn't like it healed it.
Sure.
It helped it.
It just managed the pain probably
Right.
better.
It
Right.
kind of helped it. Sometimes I think just that tape on there brings attention and you,
Move it better?
no, you avoid moving it
Oh, sure.
in the painful areas.
I don't, be honest, Brad, I don't really feel it. I don't feel the tape at all.
But when you move, you probably feel a little bit
Oh,
of
a little
pulling.
bit, yeah, a little bit.
So it's
I see. It keeps you on the rails.
right.
Yeah.
It keeps you attentive to it, so
Sure.
you just don't reach over and forget about it, and then tear open the healing tissues. It pulls.
I could
and-
see easily how it would prevent some movement in your wife's
Yeah.
clavicle. I mean, it would kind of hold it in place
Right. Yeah, because hers
Instead
was
of-
pretty dramatic.
instead of grinding up and
Yeah.
down. So,
Anyways, people are probably wondering how in the hell did you get it fixed? And this is the beauty of it.
Oh.
I showed her the exercises. I said, take the TheraBand out and do this exercise and pull back. And I gave her 3 exercises to do. Make sure you do them 3 times a day. And she says, well, what's the worst that's gonna happen to this? I said, this is gonna hurt when you do this and do that. She says, well, I'm not doing those exercises. You're not gonna do them. I said, what?
the number one patient in Brad's life is his wife, and she doesn't listen to him.
I
Not
mean, she's
surprising.
functional with it. It
So
hurts.
the tape is all you doing.
Well, the story gets better, Bob,
All
because
right.
we found out the trick, and it had nothing to do with me.
Sure.
Well, it did a little bit,
Sure.
but one thing that always irritated her when she'd sleep on that
oh,
side,
sure.
it would wake up in pain. Oh, the shoulder hurts, and I'd hear it in the morning. My shoulder hurts, and I said, "Well, don't sleep on that side." I can't help it at night. I'm just sleeping, and I turn automatically. So she says to me, "This just happened a month or so ago." She
Sure.
said, "Let's change sides of the bed," and I said, "I can't. I'm a man. I'm on the right side. I have to be on the. I can't change." And she said, "Let's do it." So I did it naturally. I'm not stupid.
Right.
So we went to the opposite sides of the bed, and within a week, her shoulder pain is gone. And it's been going on for all these years, and
See, my
she
wife-
managed it, and she could get away with it. Actually, in the last year, it's been getting worse. Maybe because she's a little older. Who knows?
Sure.
But it was amazing. She said, "Oh, my shoulder feels better." And as the week went on, it's like, and now she hasn't even talked about it. So the simplest things, find
Right.
something that irritates the joint and stop
I thought
doing
you
it.
said find something that irritates your wife
Yeah,
and stop getting rid of it.
Wow, yeah,
That
that's
means get rid of you, Brad.
yeah, I know it. But well, one way or another, changing sides of the bed. So the tape, that there are exercises. We do have videos on exercises to stabilize the shoulder joint. Really, that would be helpful. I'm sure it would.
What's the big boot camp?
The boot, well, that's where she goes to work out. She goes to
Oh,
Burn Boot Camp, and she
yeah.
loves those exercises. She does very well there. But
They don't do shoulder exercise.
well, they do, but not specific ones.
Sure.
But she's actually able to do those
Oh,
now.
let's talk about our giveaway. real
Oh,
quick. We are
gosh.
doing a giveaway this week. We are giving away the Oasis Space 4-wheel walker. Very nice walker, very well built. You can just sign up for it. BobandBrad.com. Go to the giveaway section.
Yeah.
And
Yep. It's got
win.
got platforms,
win,
brakes,
just win, baby.
really nice wheels for going outside.
Yep.
Be careful in the
envy of
cold.
everybody.